Hello everybody, I'm Dr. Rogani. I'm first year internal medicine resident at Eisenhower Medical Center, and today I want to talk about one of my most recent research that I started when I was back in Iran, and we recently got the results. So as you can see, our topic is about evaluation of different H. pylori genotypes as a predictor of intestinal metaplasia progression in patients with normal appearance upper GI endoscopy. As you know, gastric cancer is the fifth most common malignant disease worldwide, however, is the third leading lethal cancer in the world. As a physician and scientist, we are always looking into identifying the risk factor for the disease, and we want to elaborate or at least controlling them. H. pylori is a very known risk factor for gastric cancer. However, there is a very big enigma about this, and it's about the Africa, because over there the rate of H. pylori infection is very high. However, the rate of gastric cancer is low. So this question comes to mind, that if there is a certain genotypes of H. pylori that can lead to intestinal metaplasia and cancer, or there are some other environmental or patient genetic factor that can define the interaction between H. pylori and gastric mucosa interaction and progression to intestinal metaplasia and then cancer. Unfortunately, there is a lot of controversy in this field, and especially there's a lot of controversy about carcinogenicity of different H. pylori strains. And there's unmet need for doing more research in this field for clarification. So the aim of this study was to evaluate the relation of different H. pylori strains with precancerous gastric lesion in patients with normal appearance upper GI endoscopy. Okay, now about the method. So our research was a kind of collaboration between Yazd University and Tehran University of Medical Science and Eisenhower. So basically taking sample and taking biopsy were done in Yazd University of Medical Science. However, genotyping and doing PCR was done at Tehran University of Medical Science, and at the end gathering data and interpretation was done here at Eisenhower. So briefly, a total of 620 patients over 50 years old were first enrolled in the study, and then patients with any kind of antibiotic used during the past 1 month of referral to the hospital were excluded from the study. And at the end, 150 patients with absolutely normal appearance endoscopy were selected and enrolled for our data interpretation. 6 gastric biopsies were taken from each patient, 2 from antrum, 2 from lesser curvature, and 2 from greater curvature. And then the biopsies were sent to the gastrointestinal pathologist. Were sent to 2 gastrointestinal pathologists for identifying the normal tissue versus intestinal metaplasia. H. pylori infection was detected by rapid Urose test and then confirmed with PCR. And genotyping was done by using specific primer for each H. pylori variant, and at the end the data was analyzed using chi-square and logistic regression. Okay, now let's talk about the results. So a total of 150 patients with normal EGD were enrolled in our study. The mean age of our patient was about 65 years old, and they were divided into normal or precancerous group according to their pathology result. Their demographic characteristic of, the demographic characteristic of patient are shown in table 1. The rate of intestinal metaplasia were about 22% in our patient, and the rate of H. pylori infection was about 60% in our patient. We investigated the 12 strain of H. pylori, and among these 12 strain, CAG-A, VAC-AI2, VAC-AS2, and VAC-AC2, and VAC-A I1 were the most common strain among our patients, respectively. Although H. pylori infection was significantly higher in precancerous group, but there was no significant difference in H. pylori genotypes between precancerous and normal group. Okay, so as you can see in table 2, there are some genotypes that are more prevalent in precancerous lesion. However, the difference is not significant as the p-value is higher than 0.05. So the conclusion of our study is that there is no significant difference in genotype, in H. pylori genotype distribution between patient with or without precancerous lesion. According to our study, while H. pylori infection is an important risk factor for gastric cancer, its genotype cannot independently predict the risk of intestinal metaplasia. Now, someone might ask that why we choose precancerous lesion instead of the cancer lesion. So I want to say that one of the unique aspects of our study was choosing the precancerous lesion in normal appearance upper GI endoscopy. Because choosing a precancerous lesion has an advantage because we want to identify the risk factor at the very beginning stage of cancer progression. Because as we reach the very end, as we reach the adenocarcinoma, there are more and more dependent and independent factors that might have caused cancer progression, and these factors can lead to bias in our analysis. Also, I want to mention that our next step is to identify and evaluate if combination of these certain genes in H. pylori, for example, if the combination of CAG-A and VAC-A1, for example, can predict intestinal metaplasia and cancer progression. Now we're working on those analyses, and the result will be released soon. Thank you so much for your attention and your time. I hope the COVID situation gets better and better very soon, and we can have actual meeting instead of the virtual one. Thank you so much again. Stay safe.